My name is Sring. I am from second year, third sem BSc Nursing, and today my topic on seminar is about the nursing management of COPD. Okay, have you ever wondered if you are likely to breathe through a straw? This is the condition that is described by most of the patients with COPD about their situation. So COPD, it is one of the most complicated diseases, lung diseases, which provides a unique challenges to the healthcare professionals in this current world. Now let's go through the deep world of COPD. COPD, it is a group of lung diseases which makes the patient difficult to breathe. When we are talking about COPD, it consists of two types, that is the chronic bronchitis and emphysema. Chronic bronchitis, it is the long-term inflammation of the bronchial tubules which leads to excessive secretion of the mucus, which makes the airway narrower and makes the patient difficult to breathe. And talking about the emphysema, it is the damaged air sacs in the lungs which makes the oxygen difficult to flow into the bloodstream and leads to the patient difficulty in breathing. Now, as a nurse, we have to be very vigilant and very prevalent in managing the COPD from its causes to the clinical manifestation and to the management till the patient education. Now, we will discuss about the nursing management of COPD. The first nursing management, it involves monitoring the patient's respiratory status, the second one, medication administration, third one, provide oxygen therapy, and the last one, we will discuss about the care plans of COPD. Number one, that is monitoring the patient's respiratory status. In monitoring patient's respiratory status, we have to first assess the patient's vital signs, vital parameters, and listening to the breathing sounds, and finally analyzing the ABG. By ensuring vital signs, breathing sound, and ABG, we can determine what care we have to provide the COPD patient. To the second one, that is medication administration, it involves from the bronchodilators till the corticosteroids. When we are administering medications, the respiratory medications to the COPD patient, the first thing is we have to be following the 14 rights of medication, and it mainly involves right time, right dosage, right patient, right drug, and right frequency. Now, after providing medication to the patient, we have to also ensure that the patient have to be educated about the potential side effects, and we have to also report the physicians if there is any adverse effects of drugs on the patient. Now move on to the third one, that is the oxygen therapy. Whether we will use the nasal cannula or the face mask, first role of the nurse is that we have to make sure that the oxygen that we provide to the patient should be effective, accurate, and it should be on time and within the limit. In order to prevent the oxygen toxicity, we have to be more alert about the concentration of the oxygen that we provide to the patient. So, if the nurses deals with a patient who is anxious and depressed about their condition, nurses should make sure that we should provide emotional support to the patient by listening to their problems and by assuring our care to the patient. And in the advancement level, we have to also give the mental education, that is counseling and all, to the patient, how to manage the emotions and how to reduce the depression level. Now finally, I will discuss about the nurse's care plan of COPD. The nurse's care plan with the COPD, it will depend upon the emotional factors, their activity tolerance level, and then the cardiopulmonary responses. The number one nursing diagnosis can be ineffective breathing, that is due to the excessive secretion of mucus in the airway of the lungs. The patient will face difficulties in breathing. Moving on to the second nursing diagnosis, it will be activity intolerance. Some patients, due to the difficulties in breathing, that is due to the difficulty in exchange of carbon dioxide and oxygen between the air sacs and bloodstream, the patient will face difficulties in carrying their daily routines or doing exercises. I will discuss about the last diagnosis, that is deficient knowledge. If the patient do not have efficient knowledge how to deal with their disease condition. For example, in this case, it is COPD. So, if the patient do not have knowledge, previous knowledge about COPD, now the patient will not be aware of the medications, the available treatment that the patient can undergo in this kind of world. Lastly, if we carry out this nursing responsibility or nursing management in COPD, we can eradicate the world from COPD. Thank you so much for paying your attention to my seminar, and hope you guys have got some information from what I taught about COPD. Thank you so much.